Good afternoon, everyone, and welcome to our PFRH noon seminar. It's always fun when I get to describe the department to folks who are not from the school, how I talk about, population, applied population health, and life course. And then I say, we have a different mix in the department. We have some teams that work primarily globally. We have some that work primarily domestically. And then we have the Gates Institute team where we have half of our colleagues who are in Nigeria today and joining us from afar, and half who are going to be here in the room. So it gives me great pleasure today to introduce the William H. Gates Senior Institute for Population and Reproductive Health. So this is one of the large initiatives in the department that really comes together to think about family planning, reproductive health, demographic dividend, and a whole host of other issues. As many of you are likely aware, we had a very successful search, and thanks to Mike Clegg, who chaired the search committee, and Dr. Phil Anglewicz is now the new director for a few months so far for the Institute. And Phil, we're just really thrilled for your leadership and the directions that you'll take the Institute and the department in your new role. I would encourage those of you who are not familiar with the Institute, clearly listen in today, hear about some of the really exciting things that are happening, but the Institute also has a terrific website with lots of resources, which you actually, for students, you may find useful for some of your classwork as well. And the Institute also has been really critical in the department for providing wonderful training opportunities for our master's and doctoral students. So some of you in the room and online, I know, have worked very closely on different projects, be it PMA, AFP, or a whole host of others. But we just really appreciate sort of the ongoing partnerships that many in the Institute have with all of our trainees as well. So Phil, I'm going to turn it over to you to kick us off, and I'll let you introduce the folks who are going to be sharing some of the exciting work today. So thanks so much.
Great. Thanks very much, Cynthia. I appreciate the introduction, and we're thrilled to have the chance to talk to the department about the work we're doing at the Gates Institute. I hope everyone can hear me okay. The internet here seems to be pretty good, but let me know if I happen to cut out at any time, and I'll see what I can do to fix it. We also appreciate the flexibility with format. So Cynthia, as you pointed out, 3 of us are in Nigeria right now at the National Family Planning Conference, which, is highly important for the type of work that we're doing and for promoting things like our platforms like ICFP and FPNN that we'll talk more about on this in this session. So thanks very much for allowing us to present in sort of a hybrid format. So the presentation that we'll do today is an overview of the William H. Gates Senior Institute for Population and Reproductive Health. And the focus of this presentation is going to be on some of our latest, most recent work and our recent innovations. Of course, what we'll present today is far from comprehensive in terms of the work that we do. There's other major platforms like TCI in particular that hopefully we'll have another chance to talk about in the future. And we're working on another opportunity for TCI to discuss the work that they do as well as other platforms as well. So as an overview for this presentation, we're going to start with just, a discussion of the Institute itself in terms of the work that we do. Then we'll move on to discussion of our research agenda, which is something led by Caroline Moreau and some new and exciting innovations there. Then we'll turn to Kelly Wellborn for a discussion of ICFP, where we've just determined and released our theme for the conference next year. Following Kelly will be Carolina Cardona, who will talk about demographic dividend and the work that we're doing there, which involves collaboration and contributions from USAID, the UN, and other institutions. And then we'll end with the Family Planning News Network, or FPNN, presented by Christina Sherrill. And this is a platform that's relatively new among those at the Institute, and one that I think has great potential and is growing rapidly. So once again, thanks very much for the opportunity, and move to the next slide, please. All right, looks good.
Okay, sounds like it's,
Perfect.
thank you.
There we go.
Thank you so much.
All right, thanks again. So starting with some of the broad points of the WHGI, our vision is a future where scholarship and science improve health and transform lives at scale. So again, I think the fact that we're situated at Johns Hopkins Bloomberg School of Public Health and PFRH really gives us, I think, a great vantage point, I think, to combine scholarship and science for the work that we do at the Institute. And our mission is to cultivate new ways of thinking and doing to accelerate locally led progress in gender equity, sexual and reproductive health and rights, population dynamics, and equitable development. So a few things to point out about this mission statement. First of all, locally led is critical to what we do, and we work very closely with some centers of excellence that are collaborators and have been collaborators for years and actually decades now to do the work that we do. And increasingly, we're shifting a lot of the work that we do to the countries where we operate and doing slightly less in the United States and in Baltimore, following trends in the field. Second of all, we think about sexual reproductive health and rights as combined with gender equity, and that both of these combine to represent critical dynamics in the field that dictate how sexual reproductive health and rights develop and the dynamics that occur in the countries where we operate. So gender and sexual reproductive health and rights are closely tied together, and I'll talk more about that in a second. Also, we refer to what we do increasingly as sexual and reproductive health and rights, and there's discussions about referring to the work we do less as family planning reproductive health. So this is an important discussion that the field is having right now, and one that we expect to continue at ICFP. And then finally, or actually not finally, next, we're also doing a lot of work in population dynamics, thinking about demographic futures and the demographic changes that we're going through both in higher and lower income countries, and the impacts that has on sexual reproductive health and rights and a broader range of issues as well. And then finally, equity is increasingly important in what we're doing, and I think you'll hear more about that when we get to the ICFP section. Next slide, please. So we recently had a strategic refresh for the Institute just about a year or two ago. And in this process, we identified 5 global programs that really make up the core identity of the Institute: research, measurement, and data monitoring, policy advocacy and community building, best practices scale-up, next generation leaders, and demographic futures, population, and environment. So the fact that these are portrayed as puzzle pieces in the diagram to the right shows that there's a lot of connection between all of these global programs. And also, as you see in the center, we see gender equity as something that cross-cuts through all of the work that we do. And then the values that guide our work and help us to guide the execution of what we do is interdependence, inclusivity, and excellence. Next slide, please. So we execute these global programs through a lot of the platforms that we have within the Institute. So for example, policy advocacy and community building. This work is carried out through ICFP, FPNN, both of which you'll hear about more in this presentation, as well as smart advocacy. Research, measurement, and data monitoring is carried out through PMA, demographic dividend, TCI, ICFP, and reproductive health centers of excellence. Best practices scale up through ICFP and TCI. Next generation of leaders, we focus on developing the next generation of leaders in our field through 120 under 40. The Let Them Know program, ICFP, the Challenge Initiative, TCI, and the Summer Institute that we host here in PFRH. And then demographic futures, population, and the environment, we carry out through our work in the demographic dividend that you'll hear more about shortly, and ICFP. Next slide. And then finally, the work that we do, we see as better captured by the platform philosophy towards the work. So unlike thinking about things in terms of projects that usually have a defined start and end date, we think in terms of platforms that have that are ongoing. A good example of that is ICFP, which is has gone through several iterations to date and has evolved over time. Also, platforms are not dependent on one donor, but can be flexible to different donor needs, and can also change over time to meet the needs of various donors and the broader field as a whole. So we approach things more through platforms that attract support from a range of donors to help to execute each of their strategic interests. Next slide. So now moving from the broad overview of the center, next I'm going to turn it over to Caroline Moreau to talk about some new innovations in the research agenda for the WHGI. Over to you, Caroline.
Thanks, Phil. And so as the new research director, I have the privilege of assisting Phil, and I have more time to reflect on our ongoing work and on contributions today, as well as thinking about a roadmap to address opportunities and challenges in the field. And I would kind of suggest both immense success, but ongoing challenges. So after a decade of renewed interest in investment in family planning, starting with the Ouagadougou Partnership in West Africa, the London Summit, we can celebrate many successes. Establishing family planning is one of the most cost-effective public health strategies. For $1 invested, we can expect a return of investment of $30 to $50 in reductions in infant and maternal mortality, with more long-term economic benefits along the long term. Our monitoring tools, including the Institute's flagship PMA program, has evidence accelerated progress, especially in low resource settings in sub-Saharan Africa, where you see a 10-point increase in contraceptive use just over 8 years. Progress is also evident in research, with innovative methodologies and measures supporting patient-centered approaches, expanding beyond contraception alone to encompass a wider spectrum of reproductive needs, including infertility and abortion. However, at the same time, we may suffer from some of those successes, some considering the mission accomplished, and they turn their attention to other priorities such as climate change, planetary health, or other pressing issues. Also, general progress masks growing disparities and that leads to protracted demographic conditions with high fertility rates in rural areas and plummeting fertility rates in urban areas in some of those low-income settings. And as such, inequities might be growing with significant segments of the population who are left behind. These concerns are exacerbated by the fact there are growing external shocks, whether economic, sanitary, environmental, that are diverting resources and drying up resources in our field. Finally, our current investments ignore specific population needs. They also leave out important segments of research, including implementation science, to better understand not only if interventions work, but for who they work and why they work. So these reflections are opportunities for us to think about our current research, what we do now, and where we should go. And this journey is represented here on the screen in the ways of frameworks that you probably can't see, but just kind of in a minute summary. Basically, this framework is centered on individuals who navigate their reproductive trajectories across their reproductive careers. And this is and their choices are conditioned on their partnerships, as reproductive health is mostly a dyadic rather than an individual outcome. The dyad brings their own intentions and experiences and interact within a socially constrained system based on differential power, socioeconomic constraints, and access to resources. Themselves are conditioned on policies and community factors at large. So basically, this is what the framework tells us. So on the left is what we do. We currently mostly rely on cross-sectional research. We center on women of reproductive age, and we examine contraceptive behaviors. We expand to some extent this work to include short-term longitudinal data such as PMA, explore contraceptive dynamics through that longitudinal projection. We also recognize family planning is more than just contraception, but a holistic approach to achieve individuals' reproductive goals. And that includes research related to abortion and infertility. However, we also have yet to consider a broader life course perspective from adolescence and early adolescence through menopause to understand people's reproductive careers. We also need to better incorporate that dyadic perspective and understand how these how these negotiations are affected by external constraints and social hierarchies, especially in the context of polycrisis and rising external shocks. So this leads us to identify some potential thematic expansions that are listed here around life course, dyadic perspectives, intersectional perspectives, programmatic, and population dynamics. We also recognize the need to innovate in terms of methodological innovations through current work on measurement, while expanding also our analytic approaches through AI across these cutting themes. So to be a little more specific, we believe there's an opportunity to better integrate reproductive needs across the life course, from prevention to promotion of pregnancy, depending on how people's reproductive goals change over time, and also using a life course perspective with longitudinal data to specifically focus on critical transitions. One of those is adolescence, but there are many transitions that open opportunities for interventions. The early marriage stage, postpartum, up to menopause. Next, we strongly believe the focus should shift from individual to dyadic perspectives, which means we need to better understand men's perspectives on reproductive health, their own needs, and then bring in the couple dynamics and the study of bargaining and cooperation in pregnancy management. This is really critical if we want to shift from an individual level intervention perspective to a more family and couple-based approaches. Next, given rising inequalities, we should also invest more efforts into understanding the mechanisms that underlie the fact that some populations are left behind, and how shocks may affect different populations in different ways. And that is to better support precision public health interventions that are really tailored to the needs of specific populations. And that brings me to a fourth consideration, which is to bridge out research with programs. We've started that with a PMA project used as an evaluation tool, but I think we need to expand to incorporate also implementation science to understand why and for whom interventions operate and work, again, to tailor approaches to specific needs. And finally, these people-centered approaches go hand in hand with macro-level analysis, and Carolina will talk more about the demographic dividend work to understand how shifting patterns of fertility are driven by and drive social, economic, and environmental change. In terms of methodological expansion, we have two areas of investment. As I indicated, measurement, a potential measurement incubator, which is to have kind of a center and a centralized approach to develop new indicators that are in line with the patient or people-centered types of approaches and interventions that we want to implement, and also integrate different ways to approach the data with artificial intelligence that might help us with big data, uncover patterns, integrate different kinds of data, and ultimately also help us think about using individualized or personalized learning instruments for intervention. Finally, I will end this here. We have a lot of really exciting types of projects that fit these different purposes. I think one of the strength of this institution or a center is really to bring together these different perspectives and from an individual project, make this a more general narrative to lead the field in terms of policies and intervention, translate the science that we generate into actionable public health goods. So thank you. And I think, who's next?
Thanks, Caroline. Now, next it's over to Kelly for ICFP. I think you're muted, Kelly.
So excited to be able to talk about ICFP. It is the one platform that we have that cuts across all of our global programs at Gates Institute. And there are many reasons for that. I am the chair of the International Steering Committee Secretariat for the ICFP. And we are excited that it's coming to Bogota in November of next year. We have never, we've only held the conference in Africa and Southeast Asia. And so we are thrilled to be able to bring it to Latin America in the coming year. Next slide, please. So we've held the conference, this will be its seventh iteration, which it's really grown quite considerably over those many years. In 2009, Gates Foundation and the Gates Institute, under the leadership of Amy Choi, came together to help put family planning back on the map. And they were bringing our research, our reproductive health centers of excellence together from across Africa, and I think one in Southeast Asia at the time. And they wanted to bring them all together to have that moment to share research, best practices, really get down into some of the program implementation efforts that were taking place. And they were hosting that in Kampala, Uganda. They expected 800 people to show up, and 1,200 did. 1,200 attended, venues were overflowing, and they realized that they were onto something. So you can see here the list of the different themes across the years. You see universal access there in a couple of different iterations. Demographic dividend 2018, and we talk about local actions, global commitments, and access and choice. This year we've gone back and forth between several different things that were on the community's lips every time we spoke to them. We kept hearing about the polycrises. We heard about teen pregnancy quite a bit over the last several months, almost a year since we've been kind of polling the community on what is really important to them at this moment. And we've settled on something that I think we can all agree on. And next slide, that is equity. So we have been very excited to present this as an option for the theme of this next conference. If you'll go to the next slide, we've walked the core organizing group and the International Steering Committee through our tagline, equity through action, advance sexual and reproductive health and rights for all. And we went back and forth a bit about the inclusion of rights and the statement that it makes about the way that we're approaching this conference. It's not just family planning anymore. We are looking at the full spectrum of sexual and reproductive health and rights, and are very excited to be moving forward with this theme. If you go to the next slide, please. So this will definitely put equity at the center of everything we do, not just at the Gates Institute, but very clearly at the ICFP. And so there are a number of things that we're doing across the conference and the platform to really make sure that we are that we are centering equity. So shifting power and advancing equity, we have a power shifting, quote unquote, subcommittee. And we're really getting down into brass tacks with regard to what we're doing across the work, not just within our own organizations, but our work with partners across the field. So we're expanding content, as we just mentioned. SRHR is really helping us to expand what we're talking about, what we're really focusing on. Tracked list is broadened this go around. Caroline will say, you know, we've taken it from just family planning and very clear contraception focus to fertility across the life course. And we're really excited to be expanding the things that we are taking on inside of the conference. We'll look at a little bit of a track list in just a bit. Native language speakers are those that will be scoring abstracts written in both French and Spanish, so that we are sure that those are being scored fairly and accurately. Equitable leadership across all of our different touch points. We have the core organizing group, the International Steering Committee, the National Steering Committee. They're all intergenerational, intersectional with regard to the areas of the work that they're coming to us from. We have Global South and Global North representation on every single organizing committee. As far as intergenerational session moderation, we are very clear that youth are still a big focus for ICFP. Adolescent and youth engagement is high at the top of our list as far as the things that we are looking to achieve with ICFP and preparing that next generation of family planning leaders. We have a Trailblazers program that chooses between 40 and 50 young people. And by young, we use the African Union definition of youth, which is 35 and under. We have those Trailblazers integrated as soon as possible into that subcommittee work. So really before even most of them met the first time, the Trailblazers were chosen and were integrated into each of those subcommittees so that they could have impact on all of the different activities that are planned through those subcommittees. They have a 2.5-day youth summit where it's a pre-conference and it's planned for them and by them. So we have youth coming out of the AYSRHR, or Adolescent Youth and Sexual Health Global Roadmap for Action. And so we are working with that group of over 40 youth-led organizations to organize the Youth Summit and other activities that are happening at the conference. A Lunch with Leaders event is an intergenerational event where youth are seated at the table with policymakers and other leaders from their own countries and have a conversation over lunch about specific topics that they're interested in talking to those individuals about. Then we have a mentorship program. So a lot of really focused energy on ensuring that youth are prepared to take up the mantle and run with it. Language equity across the conference, not just at subcommittee meetings, not just at the conference itself, but inside of our International Steering Committee meetings, inside of our national steering committee meetings, and making sure that we are including everyone across our community, both the National Steering Committee side, as well as our Francophone West Africa counterparts. And then as far as environmental equity, we are in a convention center this go around that is completely green. And we're talking to them about a number of ways that we can decrease our footprint while we're there. So we'll go to the next slide, please. We have not just built a conference that's reaching over 40,000 people, but it is also a platform and a movement. The community is at the heart of every single thing that we do. It is the reason for this conference being such a success. We are working with over 70 organizations across the reproductive health sphere. And many of them are sponsors that help to ensure that this conference can continue and ensure that we can bring quite a number of people to the conference itself that wouldn't otherwise be able to come. Next slide, please. So not just those numbers that you saw about the 40,000, but we had 3,100 abstracts submitted, about half of those accepted in 2022, 730 abstract reviewers, 300 sessions, 63 side events, I think 30 pre-conference events. There are so many things that are happening, not just at the conference itself, but in the days leading into the conference. And then that platform that we were talking about is utilized to launch innovations through webinars. We host conversations between experts across the field. It's really a way for the community to come together to get information, not just during the conference, but in all the months in between. Next slide, please. So many plenaries are held and hosted there at the conference. We have youth speaking on many of them, if not all of those plenary moments, and they plan their own plenary on the third day of the conference. So they're very well integrated across the board. If we'll go to the next slide, there are many highlighted sessions that we host to make sure that we are touching on those really hot topics of the day, those innovative elements that have been uncovered that people want to share. And then we really do spotlight those individuals that are doing incredible work, that are inspirational and really do motivate us all to move forward. Then if you'll go to the next slide, we have several awards that we give away, not just for global humanitarians who are giving their own personal wealth to family planning and reproductive health, but we also have lifetime achievement awards. And we have an Excellence in Leadership Award, or what we call the Excel Award, that spotlights countries that are making great strides in family planning, individuals as well as organizations. So people get very excited about winning those bragging rights at the end of the conference. If you go to the next slide. The conference is also about making commitments and about holding governments to those commitments. And so the ICFP stage is one of those places that parliamentarians and ministers are held up and are praised for the things that they're doing and the policies that they're implementing. And it's also a way for us to continue to hold them accountable. Next slide, please. And we've gone through a number of the ways that youth are integrated into the conference, but those youth were 450 strong in 2022. We're expecting about 600 youth in the ICFP 2025. Next slide, please. So with regard to the ICFP subcommittees, we have 11 subcommittees now. We added power shifting as an official subcommittee, as well as environment and climate change this year. So we're seeing a big focus with regard to climate change, and really excited about doing some different invited sessions and other activities that are going to focus on that particular topic. With regard to the scientific overview, we talked a little bit about those elements there, but with those 14 tracks this year, we'll be really highlighting quite a breadth of topics. Next slide, please. Abstract submissions will begin on January 15th and wrap up on March 15th. So there'll be a 2-month window. And we have several different areas that one can submit an abstract, not just scientific research, but program implementation, as well as advocacy efforts. And you can see the distribution of those in the 2022 conference there. Next slide, please. So drumbeat events, we're actually here in Nigeria, hosting one of our drumbeat events on the lead into 2025. Those drumbeat events are meant to continue that momentum between conferences, to really get down into the weeds with the communities and the different regions across the globe, to find out what really is important to them, what they want to share with the rest of the world, those successes that they're so excited to make everyone aware of, and to help them potentially achieve the same success. And then to really think about how they can use the conference to achieve their goals. So whether it's inviting specific ministers to the conference to put them on that plenary stage, or to ensure that their youth are able to come, those young scholars. So we're really working closely with different regions to just make sure that ICFP is helping them deliver on what they would like to see. Next slide, please. So this is the last slide that I'll show you here. There are a million ways to engage with ICFP, and we really hope that people, especially there at Johns Hopkins Bloomberg School of Public Health, will take the time and investigate those ways and find those subcommittees that speak to you, and really dive in and help us to ensure that we're doing the best for the community that we can, and that you're doing your part to make sure that we are keeping family planning on the global agenda. Thanks so much.
All right, great.
Thank you,
Thanks,
Kelly.
Kelly. Now, next up, we have Carolina, demographic dividend.
Thank you, Phil. Hi, everyone. I feel like this is like a speed dating with the Gates Institute content. So I'm going to present on demographic dividend. And this is just a big overview of what we're currently doing at the Institute and what we have been doing so far. I'm going to start with a slide of what is a demographic dividend, because it might not be well known for everyone. So basically what we see in a demographic dividend, of what we mean by one, is when a country experiences changes in their fertility rate, and that this happens mainly when we have high fertility settings. They go through a decrease in their fertility rates, and that's going to translate into changes in their population age structure. As you can see in this pyramid here, you can see this is an example of Thailand in the 1970s, that it had a perfect pyramid shape because it had high fertility. And then as it starts decreasing, you can see how the shape is no longer looking like a pyramid. And you see that there's like a bulge in the people who are between the ages of about 14 and below 30s, which we call that they're working age populations. And what we have seen so far in other countries is that when there is this youth bulge or this increase in the working age population, that countries can take advantage of this in order to increase their economic output and basically grow their economy. A lot of the experience has come from the experience of East Asian countries. And something that it's interesting to note, that it's not called a demographic gift, because the country is not going to reap the benefits of economic growth immediately. There needs to be like a proper investments in the country, and there needs to be mainly a favorable policy environment. Otherwise, the economic gains will not be gained automatically. So as I was saying, most of the experience comes from East Asia, where 1/3 of the economic growth that took place between the 1960s and 90s was attributable to the rapid changes of their demographic transition. So that's just a big overview of what is a demographic dividend. I hope you can hear me, because as you can see, I'm pregnant, so it's quite difficult to get close to the mic. At the Institute, most of the work that we've been doing has been focused on high fertility settings or high fertility countries. And you may be wondering, but how many countries are in this current stage of their demographic transition? So this is a scatter plot that shows how countries are distributed globally based on their total fertility rate, which is shown in the y-axis, and then the projected share of their population that is going to be of working age. As you can see, there are two lines, red dotted lines, that are dividing this chart. So we're using a definition of a fertility rate of 4. If it's above 4, then it is a high fertility setting. And then if their working age population is projected to growth, then they'll be on the other side of the red line above 0. And if they're below 0, then their working age population is projected to decrease. Most of the work at the Institute has been focused on the blue countries, those that have high fertility above 4. and those that are between a level of replacement 2.1 and between the 4. But in both settings, the blue countries are expected to have an increase in their working age population. Now, you may be wondering how many are these countries, where we can see that those with a fertility rate above 4 are around 37 countries. Most of them are located in sub-Saharan Africa, and we can call them pre-dividend countries. And then we also see that the other group of countries that are in an early dividend category that have a fertility rate below 4 but above replacement, we have 55 countries. Not most of them are in Africa. Actually, a lot of them are in Asia, and some of them are in Latin America. But we do see that there are some countries in Africa that are already in this stage of their demographic transition. So in summary, the countries that we're working with mainly at the Institute are the blue ones, either the light blue or the dark blue. As I was saying in the first slide, it's not automatic. It's not a demographic gift. It's not something that will come automatically for a country. There needs to be a favorable policy landscape, what we call. There needs to be good conditions for education so that the people that are going to enter the labor market are educated. But what happens if there is a mismatch between this education and then they go into the labor market, but there are no labor opportunities? So there needs to be a conversation across different sectors in order to ensure that there is a proper environment to absorb them and to increase their economic output. What is a favorable policy environment? Well, there have been multiple definitions, as you can see here. There's one from the African Union, PRB, or Population Reference Bureau. The World Bank also has their own definition. As you can see in this slide, they're quite similar. But at the Institute, what we've done is we've conducted a scoping review of all the evidence that is produced about factors that are relevant for a demographic dividend. And in our definition, there are 5 sectors that are important in order to accelerate the transition, but also to ensure that there are labor opportunities and that this dividend can be reaped. So some of the sectors that we identify are family planning, maternal and child health, women's empowerment, education, labor markets. And the last one is mainly focused on the macro level of the country, because none of this can happen if the country has political instability or institutions are not solid. So it is important to look at what the country has, solid governance and economic institutions. This is an overview of the framework. And as you can see, we put the different sectors that we've identified depending on which stage of their demographic transitions the countries are located. So if a country has high fertility, meaning above 4, then the emphasis should be played in family planning, maternal and child health, education, and women's empowerment. If the country has already gone through a decrease in their fertility rate, but still above replacement, then they should also start focusing or thinking about the labor market in order to ensure that there will be a labor market to absorb those working age people that will enter the economy. A lot of the work that we've been doing at the Institute has been focused on the policy side of things, because we do have lots of tools that are keeping and monitoring output indicators, such as the proportion of women who are using contraception or total fertility rates. We do have those tools out there. So most of our work has been focused on the left side of this figure here, in order to measure whether there are policies in place, whether there are programs in place. We have not been able to focus a lot on whether those are being implemented, but the first step is to focus whether they're existent in the country. One of the tools that we've been looking at the Institute, we developed, is the Demographic Dividend Effort Index, in which we are keeping track of what is the level of efforts that are being put in place to develop or to create this favorable policy environment. I won't go into the details of this project because this is just a big overview. But so far, we've collected data for this effort index that has a questionnaire for each of the different sectors that are part of our conceptual framework on demographic dividend. And so far, we've collected data across 8 countries that are listed here. And to emphasize, and to Phil's point earlier, is that none of the work that we've been doing comes as a silo from the Hopkins side. We always have local partners who are the ones leading data collection efforts and the coordination of their projects. So these are the institutions that we've worked with so far. And just to mention that I started working on this project when I was a PhD student, so long time ago. And the funding to collect all of these different data has come from different institutions, and the most recent one from UNFPA Nigeria and from USAID for the Philippines. And you can visit our website. We have some of the reports posted there and the different outputs. This is just to show you how this score looks like. It's a scale that measures from 0 to 10 in order to measure the level of effort that the country's putting in place. You can compute this for the specific sectors. You can compute this as a total score. You can compute this across the different ways that the questionnaires are structured, and you would get a different score. And I just want to show this one very briefly, which is the data that we've collected in Nigeria. And this was the first time that we did a subnational survey, because the Nigerians at the national government, when we did the national survey, they very emphasized that there are significant, that they thought that there are differences at the subnational level, and that the way that a local government works in one state is different than another state. So they were very interested in knowing whether we could capture this. And this is just to show you the score across the different sectors. But you can just look at the first one here, at the total one. You can see how each color represents a different state. And you can see how the score is not consistent, or is not the same across the states. You can see that there is variation even within a country. And that makes sense, because states have different policies. So it's not expected that national policies are going to be equally existent across all of the states, and they have different policy landscapes. So to conclude, and then I'll pass it over to Christina, and we're perfectly on time. Most of the work that we've been doing has been focusing on the policy side of it, because we know that having a favorable policy landscape is a necessary ingredient in order to reap the economic gains of the demographic transition. Also, to emphasize that a lot of our work has focused on high fertility countries. That does not mean that we also have an interest in focusing on low fertility countries, but to date, all of our work has been focused on high fertility countries with young populations. This year, we had a grant from USAID that has helped us to investigate where does climate change fits in this demographic dividend conversation, because it's about population dynamics. And it has been a very interesting project. We're not showing results in this presentation, but it's something that it's ongoing. And we actually have some students from the department who are supporting this work. And then something that we want to move forward is to connect this policy landscape to outcome indicators, to actually test how much does it really matter, and how much changing certain policies can actually support or increase the economical gains of a country. So that's it for demographic dividend. Now you have FPNN. So on to Christina.
Thanks, Carolina. And thank you everyone for joining today. I'm assuming everyone can hear me okay, so I'll just keep going. If you go to the first slide, please, you can see the core FPNN team, and I just wanted to start by giving them a huge thank you. None of this would be possible without them. So we have Molly Maisner, who's a communications associate at the Institute and leads on design and digital, and anything that comes out from the Institute that's beautiful is probably Molly's work. And then we have Matt Matassa, who's a strategic communications consultant that's been working with ICFP since the inception in 2009. And together we're just really excited to be able to bring FPNN, and most recently we had Natalie Apcar join our team as well. So just wanted to say thank you to all of them. On the next slide, you'll see the overview of the Family Planning News Network. So we're a community-owned and community-powered SRHR media network. And what this means is that rather than having journalists who are in regular media outlets reporting on issues, we invest in the community to report on the issues that are most affecting their communities themselves. And so on the next slide, you'll see some of our key goals. So it's community-powered media, innovative storytelling, elevation of Global South voices, supporting research dissemination, which is something that we're working on for 2025 in concert with ICFP, and then finally building partnerships. And so all of what FPNN does helps to elevate the work that Gates Institute does across all of its other platforms. It truly was born out of seeing the way that our platforms exist currently, and how could we continue to elevate them, elevate the amazing work that's coming out of the platforms and the community in a way that resonates with people and in a way that they want to receive that information. So on the next slide, you'll see an overview of what it means to be an FPNN community reporter. And so this is for journalists, advocates, communicators, technical experts, bloggers, social media influencers, and content creators overall. And so it's not just for people that consider themselves a quote journalist. We really want to hear diverse perspectives. We want to hear from the advocates and what it means to be in a community and talking about these issues. I love this photo. The first photo on the left, it's SNM Amuzu, one of our FPNN youth anchors. And I love this photo so much because this was our first reporting trip in Malawi of this year. And of course, it was really important. We were in Dzaleka refugee camp and reporting on the impact of reproductive healthcare access, how women and families were able to access reproductive healthcare in the camp while being there. It's one of the largest refugee camps in Africa. And of course, it was so important to get the stories from the women and hearing about their access and their successes in accessing or challenges. But I love this photo because it's SNM talking to one of the husbands and hearing from his perspective about what it means as a family to be able to access contraception. And so I think it really just shows some of the beauty of FPNN, of like uncovering stories that aren't always told, talking to people that don't always get to share their voice necessarily, and finding and sharing the stories that resonate with the community, especially the ICFP community, which is the backbone of FPNN. And so on the next slide, it's just an overview again of the network itself. The network was built out of ICFP in Thailand. So for those of you who were at the 22 conference, you may remember in the exhibition hall, there was a large stage in the back. That's where we launched the Family Planning News Network. We started with a morning show. We had primetime shows in the evening. We had anchor reports. We had young youth trailblazer news, all sorts of news programs. And we wanted to be able to elevate all of the information that was happening at the conference and be able to share it with people that maybe couldn't attend the conference. We recognized even being able to go to a conference is a privilege in itself. And so how can we democratize the information that's coming out of the conference? And what we realized is that this was actually really needed and really valuable. And the community came to us and said, what you've created is really special, and we want to help you continue to build it because this means something to us. And we've been able to report our stories in a way that we haven't been able to before. And so in the 2 years, almost exactly 2 years since then, we have really grown a lot. And so on the next slide, you'll see our approach in how we engage. And so FPNN is meant to be and is incredibly diverse, whether it's across gender lines, racial lines, faith and religion, age, sex, neurodiversity, language, abilities, education. We not only do we strive to make the most diverse reporting that we can, we actively are looking at those metrics and making sure that we're meeting them and living up to our values. On the next slide, you'll see how we're approaching the regional media network development. And right now, as Phil mentioned, we're in Abuja, Nigeria. We're partnering right now with Nigeria Health Watch, which is a local communications NGO in Nigeria. And we're partnering with them on the conference to help elevate the stories coming out of the Nigeria Family Planning Conference. And so we've been building these partnerships over the last 2 years. We have some with FP 2030, the African Union. We're working on one with in Colombia as we prepare for ICFP 2025. And so this has been a very organic development. It's again, coming from the community itself, coming from the relationships we've established at ICFP and being able to continue to build them as we build FPNN. On the next slide, you'll see a nice roadmap of what we've been able to accomplish since ICFP 2022. And actually there's been more events even since this slide was created a few months ago. And so this is just a small sliver of the coverage that we've done. So we've been on 4 continents already, hoping to expand that next year. We've been at the Climate Change Conference, Reproductive Health Supplies, the ICPD Youth Dialogue in Benin. We were at the 9th African Population Conference in Malawi. We were in the Cartagena conference in July. And most recently, we were at the HIV Research for Prevention conference in Peru. And that one was really special as well, because one of the things we've been trying to do as a conference and as an institute is expand our reach. And so, of course, talking to people that are working in family planning and SRHR, but also expanding that, working with other sectors, working with the HIV community. How can the FP community learn from the learnings of the HIV community? And so we were there and making those connections in real time, and have, again, a nice partnership with the International AIDS Society that came out of our event in Peru. And so on the next slide, again, you'll see just some of the partnerships that we've been able to develop. On the next slide, you'll see some of the reporting that came out of Malawi. So we have everything from long form content, short form videos, social, we have blogs, we have something called Overheard At, which is a special segment capturing quotes and special details that people have heard at the conferences, trying to make this content accessible and as diverse as possible. So again, you'll see some of our star youth reporters, S&M Innocent, who is just enrolled in Johns Hopkins earlier this year. And so being able to continue to work with a lot of our youth partners, as well as established and seasoned reporters. On the next slide is just some of the content that has come out of our Malawi reporting trip. So we had an article in The Nation called Too Many Babies. And what I love about this article is that we were able to connect the reporter who was actually had one of our media fellows in ICFP 2022, came to the Malawi trip with us, and then we were able to connect her with PMA data, which was then referenced in that article. And so it really shows that full spectrum of how we're able to leverage all of the platforms at the Institute through FPNN and connecting reporters to the data that either they can't find, isn't available to them, or they might not have access to. And on the right, you'll see one of our other reporters, Ridwan, wrote 2 stories about queer healthcare access in Malawi. And one of them was actually nominated for a Courage in Reporting Award for talking about what it means for trans people to be able to access healthcare in Malawi and the many challenges that they face. And so we're really proud of that even within just a couple of months, we've already seen a lot of progress, and that people are starting to really see the power of this platform. On the next slide, you'll see the FPNN reporting team that we have in Abuja right now. And we actually had Kelly and team hosted an ICFP community conversations for the conference last night. And we were lucky enough to host an ICFP communications roundtable where we had communications experts from all over Nigeria talk to us about how we can better reach the community, but also put out our messaging. And it was so validating because a lot of the things they said, either the challenges that they faced or the information that they need, are things that FPNN provides. And that wasn't planned. It was just, that's the beauty of FPNN, is that it was built with the community in mind, and it's addressing many of the things that they've already identified as barriers to being able to report. So whether that's funding, media houses or outlets not wanting to or not having funding to be able to support them, not being part of the community, feeling like they're separated from the community, and we're bringing them all together. On the next slide, we're actually doing double duty this week. So we have 2 conferences at the same time, and we're doing this for the first time, actually. So shout out to Molly for helping to get all of this online while we are in Abuja. So we're supporting Innocent with the Young and Alive Summit in Tanzania. On the next slide, you'll see some of our original programming. We have the Pulse of Family Planning with Dr. T, which we host several times a year on different issues, getting to the pulse of what's happening in the family planning community. We have the Wrap, which is something that we've done at the end of conferences as kind of a takeaway of what's happened at these events. And then we host special media briefing series, as we did for the UN Climate Change Conference and some other events over the last year, and plan to do so as well in 2025. So the next slide is my last slide. It's a QR code. If you want to learn more about FPNN, please get in touch. We'd love to talk to you. We're growing fast and getting ready quickly for ICFP 2025, as FPNN is going to be the media backbone for the conference next year. And we're eager to build those regional media networks and continue to build the community in all the ways that we identify as community. So thanks, Phil.
Excellent. Thanks very much, Christina, and thanks to everyone else on the team for the presentations. As I mentioned at the onset, this only gives a very, broad and selective overview of the work that we do, but I hope this gives you a sense of the Gates Institute overall. And one just final thing to mention is that we have a long history of involving doctoral and master's students in the work that we do at the Institute. So if you have any interest, please feel free to reach out to us directly and we'd be happy to talk. So I think we're pretty close to time, but we probably have time for a few questions. So thanks for your attention, and any questions you have are welcome at this point.
Yes, we have one question, back of the room.
Thanks so much for this overview. It's so great to hear about all the initiatives happening at Gates. I'm curious how you see the rights of LGBTQ plus people into the sexual and reproductive health and rights work and agenda moving forward.
So this is Annie, and she is asking, how do we see or integrate the rights of LGBTQ populations in our work around SRHR?
Great question. Thanks very much. I think Christina highlighted some of the ways in which we've done that through FPNN, but more broadly, I think partly that involves the transition or discussion about how we refer to the work we do, whether it's family planning, reproductive health, or sexual reproductive health and rights. So when we were discussing the theme that we had for ICFP, that was one issue that came up strongly from the broader community, that we should really be careful and deliberate about emphasizing that what we work in is not just family planning, reproductive health, but also involves rights. And I think those rights, especially for LGBTQ, as well as other, populations that need advocacy, and in the context of family planning, I think is something that's critical to what we do, especially in political environments like maybe where the U.S. is going. Hopefully not, but we're all a little bit concerned about the upcoming administration, as well as countries around the world where the issues that Christina pointed out are something that's prominent for that population. So that's just some of the ways, but I welcome anyone else in the team to talk about others.
I think we're on time.
Christina, did you want to say something quickly?
Yeah, sure. I'll just add one comment. So in addition to being part of FPNN, I'm the communications director at the Institute. And so language equity is something we look at across the board. Inclusive language, whether it's the way we talk about gender identity, sexual identity, the way that we talk about people in general, and always putting people first. And so just from a communication side of things, that is always first and front of mind for me. And so I can't speak to the research side of things, but from the communications and program side, that is something that we're always looking at. And again, to speaking about the diversity in what we do, and as someone who identifies as part of that community, making sure that it's very much represented in the work that we do.
Thank you, Christina. I think we're on time. I can hear students in the hall. So thank you, everyone, and have a lovely afternoon. And thank you, Nigeria team. I guess it's pretty late for you guys, so have a lovely evening.
We're okay. Yeah. Thanks.
Yeah.
Thanks very much once again. And please feel free to reach out if you have questions or would like to learn more. Thanks.